Hola, ¿cómo están? Bienvenidos sean nuevamente. En esta ocasión, nuestra siguiente ponente es la doctora Karen Walsh. Ella es optometrista y educadora con más de 2 décadas de experiencia en entornos industriales, académicos y clínicos. Es directora de Asuntos Profesionales Globales para Supervision. Anteriormente fue líder del equipo de educación profesional y científica clínica en el Center for Ocular Research and Education, el CORE, de la Universidad de Waterloo, en Canadá. Y ha trabajado como gerente de asuntos profesionales en la industria de lentes de contacto y en la práctica clínica especializada en lentes de contacto en el Reino Unido. Tiene un posgrado en optometría clínica por City University en Londres, del Reino Unido, y es miembro de la Academia Americana de Optometría y la Asociación Británica de Lentes de Contacto. Karen, bienvenida a Latinoamérica.
And thank you very much for that wonderful introduction. And thank you very much for inviting me to come and talk at this fantastic virtual event. I'm going to be talking this morning on evidence-based approaches to improving contact lens comfort. Such an important topic. And the really good news, the headline, before we get into any of that detail, is that there are so many things that we can do with our contact lens wearers that are grounded in good evidence that can make a difference to their comfort over time. So let's get into this and see what we can uncover in this talk today. So we start with a very well-used analogy, and that is thinking about comfort and when things feel uncomfortable. We often compare a contact lens sensation and how we might improve that to wearing shoes. And one of the most obvious things in the situation you see on screen here, with the very uncomfortable pair of shoes that you see, would be to suggest to this person that they could change their shoe to something that fits, works with them much better, much soft, feels so much more comfortable on their feet. And we think about this with contact lenses an awful lot of the time. When one contact lens is not performing well enough on comfort, it is a very logical choice to recommend a different contact lens. And we'll see as we go through the talk today that that is a perfectly sensible recommendation. But what I want for you to take away from the talk today is that is not the only recommendation. And there are many other things we can think about to do as well as just changing a contact lens. But when we think about changing a contact lens, there is one important evidence-based point that we should be aware of and remember. Changing a contact lens material from hydrogel to silicone hydrogel has a great deal of benefits overall. We know it reduces hypoxic concerns, clinical signs of hypoxic changes on the front of the eye. We know it's a really good material from a silicone hydrogel point of view. The increased oxygen helps to keep eyes healthy for the longer term as well, over many long days, long years of wear, over a lifetime of wear. So great benefits for increasing oxygen flow in silicone hydrogels through a contact lens, for sure. But the important point is increasing oxygen through the contact lens. While it does all those great things, it does not by itself improve comfort. So switching just from hydrogel to silicone hydrogel in itself doesn't give a wearer a more comfortable experience. We might imagine and assume that it does, but evidence, you'll see here 2 papers for frequent replacement or monthly contact lenses, where neither the silicone hydrogel or the hydrogel was found to be more comfortable than the other. Similar results have been published and found for daily disposable, comparing comfort of hydrogel and silicone hydrogel contact lenses as well. And then even more literature reviews, 5 different literature reviews that we can look to now as well, that pull together results from a number of different studies, all conclude what I've just been saying. Great benefits for oxygen delivery through the contact lens, but that alone doesn't increase comfort. And we can have a look at one of those particular studies in a little more detail now. Now, in this study, data were pulled from a number of 3-month wear clinical trials of contact lenses, looking at end-of-day comfort. And the blue bars, you see 5 different contact lenses, lenses A through to E. 3 of them are silicone hydrogel, 2 of them are hydrogel. We also see end-of-day comfort ratings for the emmetrope in the green bar, who has no visual correction at all, and those cohort of subjects that were wearing spectacles. Now, when we look at all of these results together, end-of-day comfort actually, of course, dropped in all categories, including emmetropes by the end of the day. That was shown in a separate set of results in this paper. But comparing the absolute end-of-day comfort mean values across these different groups, actually, in 3 of the cases, the contact lenses were not significantly different in terms of the end-of-day comfort score to emmetropes, so they performed really well. And those 3 contact lenses were a mixture of silicone hydrogel and hydrogel materials. So we can get really good comfort scores with these, in this case, all daily disposable contact lenses. But as I say, it doesn't drive comfort, or the comfort itself is not driven by the actual material that was fit. But I've mentioned daily disposables in that particular study, and that's really relevant because when we're thinking about improving comfort, there is some evidence out there to suggest and to show that by switching to a daily disposable replacement frequency, coming from that reusable, that monthly situation, that we can improve comfort. Let me talk you through this graph. It's looking at end-of-day dryness and discomfort ratings for a silicone hydrogel contact lens. The blue bars that you can see are showing that lens used as indicated over a 2-week period, cleaned every night, stored in a contact lens case and reworn in the morning. And this pools the results for those who were cleaning it with either a multi-purpose solution or a hydrogen peroxide solution. The scores were very similar. And the scoring system here says that 10 is the most comfortable situation and 0 is the worst score. The only change that was made as the comparison in this study was to use exactly the same contact lens, takes away any other confounding factor, but to use that same contact lens on a daily disposable basis. So a fresh lens was worn every day, so that silicone hydrogel lens, but the solutions were taken out of the equation and any reuse of the contact lens was taken out of the equation. Let's have a look and see what happens to those comfort scores around dryness and discomfort at the end of the day. Well, you can see now by the light blue bars that they are higher, and not only higher, not only statistically significantly improved, but they are at least 1 to 1.2 points on the scale higher overall. And that's a clinically significant improvement in levels of dryness and discomfort that was experienced by the wearers only by changing to a daily disposable regime. So nice evidence here that if you have someone in a reusable soft contact lens and you're looking to try and improve comfort, a move to a 1-day disposable replacement frequency may well be a clinically significant improvement in comfort for them. But I said at the beginning of this talk, just changing the contact lens is not the only thing we have evidence for when we think about improving comfort. So just changing shoes, back to these pictures, is not the only thing we can do. And that's important because there are many patients perhaps where we might not want or be able to change their contact lens. I'm one of those patients. I can share my own example. I'm a very high myope, about -16 diopters in both eyes. So I wear a made-to-order spherical -14 contact lens. Now, in a silicone hydrogel material for my high prescription, I can only get that in a monthly disposable format. So I can't suddenly switch to a 1-day disposable contact lens and improve my comfort. But if I'm finding that my lenses are not comfortable enough, I might want to have an alternative suggestion to help improve my situation. So we don't want to always change every patient. But what else can we do? The shoe analogy, if you permit me to carry it on and stretch the analogy a little further, you know, you might have a favorite pair of smart business shoes as the middle picture, that are a little tight. And in this case, you're using something to stretch the shoe and make them fit and feel better. You might have a pair of plimsolls or running shoes in the last picture that don't feel comfortable, and you put something inside, an insole. You do something else to make that shoe feel more comfortable. Let's come back to the contact lens idea. If we're not going to change the contact lens, what else can we do in and around the contact lens situation and in and around the eye to help drive improved comfort for some of our wearers? To help answer that, it is really useful to go back to the TFOS Contact Lens Discomfort Report. It was published in 2013, and it brought together at the time all of the evidence around what we understand drives comfort. And it really looked for an evidence base of the factors that were involved in that could be proven at the time. Those factors were put into sort of 4 areas, 4 buckets, if you will. The first of which being related to the patient. You see the box up here on screen, and it talks about the gender of the patient, their age, whether they suffer from seasonal allergies, some of the medications they may be taking. Of course, they could all drive a less comfortable situation. Now, many of those factors are non-modifiable, and we can't do anything about them. We just need to be aware of them and work with them. There are a couple more buckets, of course, as expected, related to the lens itself and to the care solutions, the cleaning solutions that will be used in conjunction with the contact lens. Now, I've already talked on evidence on one of these already, so shorter replacement frequency, going from a 2-week or 4-week disposable lens down to a 1-day replacement frequency can improve comfort, for example. We see some material factors on here that we can consider. So having a high in-eye wettability is thought to be important, and low friction on the surface as well. Taking away the care solution makes a difference. We've talked about that with that daily disposable advice and results from the study already. And I'll come on to talking about the combination of cleaning solutions and materials a little bit later on. But the final bucket is where I'm going to spend a little more time of how we can improve comfort, but without changing that contact lens. And that's where the evidence sits around the factors related to the eye itself. And there are a number of areas there that we really can, using the evidence base that's beginning to grow, make a difference to symptomatic contact lens wearers and improve their overall comfort. Now, I was the lead author on this particular paper, published just a few months ago, along with Lyndon Jones, that address a number of common myths and misconceptions in contact lens wear fitting. And one of those was exactly this question. When a contact lens is not comfortable, the most obvious, the best solution I can do is to recommend that my patient changes to a different contact lens. And we went through and reviewed all the literature and came out and said, of course, in many cases, that is the right decision to do. That's the right course of action to take. But there are a number of other areas that you can consider. And I'm going to run through those in a little more detail now. They relate to the tear film and the meibomian glands. We're going to talk a little bit about vision quality and how satisfied the patient is with their vision. And then finally, we'll touch a little bit on that combination of material and care solutions. Now, when we think about tear quality, we're thinking about the tear quality over the top of a contact lens. Now, you see here the placido disc of the reflected into the tear film. It's sitting on a tear film, which is a pre-lens tear film sitting over the top of a soft contact lens. Now, as soon as you put that contact lens into the eye and into that tear film system, you disrupt the tear film physically by an enormous amount. Typical tear film in the center of the cornea might be 3 to 6 microns thick. A typical contact lens soft contact lens is 70, 80, maybe 90 microns thick. That contact lens is at least 15 times thicker than the tear film we're trying to put it into. And it immediately splits that tear film into that pre and post tear film layer. And it's no wonder that the physical presence of the contact lens in there completely disrupts how the tear film works and its stability. And we know that it disrupts that stability because the breakup time, as soon as a contact lens goes into the eye, will drop significantly and dramatically. And we know the lipid layer, particularly of the tear film, is affected. It's thinner and reduced and almost absent in wearers. So let's pay attention a little bit to why we're so keen to understand that lipid layer. And the meibomian glands, of course, are the areas within the eyelids themselves that are responsible for producing the meibum that goes into the lipid layer itself. So an awful lot of work has been done to try and better understand the influence of wearing contact lenses on the function and the appearance of the meibomian glands themselves. Does one affect the other, and can we see changes over time? Well, you'll see here on this particular slide, there's something like 22 references cited on this slide. It shows you just how much work has been going into getting a better understanding of those particular questions. And right now, we do believe there's a greater weight of evidence that says there are changes and changes in the shape and appearance, the morphology of a meibomian gland. We see those changes occurring in a contact lens wearer more often than we do in someone who doesn't wear contact lenses. So you can try and unpick that and establish that by looking at two groups, contact lens wearers, and you age match the wearer with people who don't wear contact lenses and compare across. And we do think on balance, there's more evidence to say that we do find changes. Do the changes in the appearance of the meibomian glands lead to symptomatic and uncomfortable contact lens wear? There are some studies out there that have concluded that there is an association, and we get more symptomatic wearers as the gland changes are happening. But that is not a proven fact right now. It's slightly equivocal evidence, and there is some certainly evidence out there that has not quite found that link in the same way. But a very new review paper, just again out within the last few months, pulled together all of this kind of evidence that I'm talking about and referencing here on this slide, and came to the conclusion, so this is very new news, that in contact lens wear, you do get those changes in the morphology, the appearance of meibomian glands, up to about 80% higher atrophy of those glands compared to non-wearers. And you do find changes in the quality of the secretion of the meibomian glands. So the evidence is building here, certainly, for a link between the two, and contact lens wearers ending up with more changes to their glands. Now, why is this so important? Well, think back to the lipid layer disruption I described on the tear film earlier on. And we're beginning, I think, with that growing evidence base and growing understanding to really understand how proactive we should be thinking with our contact lens wearers when we're examining their lid margins and the quality of the meibum that can be expressed from their meibomian glands themselves. Now, in fact, last year's BCLA, the British Contact Lens Association, their clear reports was one of the first places where I've seen a real call to action to say that as contact lens practitioners, as eye care professionals fitting contact lenses, we should be really proactive in how we check our patients for exactly these things. Even if someone is pretty asymptomatic, we should be going and looking for any very early signs of changes to the meibomian glands and then addressing those if we find them. I'm going to walk you through the evidence that you see on this slide listed here at the moment. But the takeaway point is that there is a growing body of evidence that says if we apply the same kind of techniques that we see when we're looking at meibomian gland dysfunction, maybe in a dry eye patient, many of those treatments have been shown to make a significant improvement in symptomatic contact lens wearers when some of those early clinical signs are seen in those patients too. And I'm going to walk you through some of this evidence in more detail. So, very simply, in contact lens wearers who are symptomatic, so not fully comfortable with their contact lenses, and showing early signs of meibomian gland changes, so some of those glands were not releasing meibum properly, and the meibum itself was not of very clear and thin quality, so reduced quality. Just by using a warm compress, the better compliance was with once a day rather than twice a day use, by the way, which is no surprise. The once a day use of a warm compress over a period of 4 weeks resulted in a significant reduction in the number of meibomian glands that could be seen that were blocked. But importantly, we got nearly 2 hours extra of comfortable wear time in those contact lenses just by making that one intervention. So here's something simple that you can do with those patients where you might not be wanting to change them to a different contact lens, especially if you're seeing those early signs of meibomian gland changes. In the same vein, the microexfoliation. So this is where we have a little tiny device with a little cleaning tip on the end and it spins. We use a soapy substance to clean along the lid margins to remove debris, dead skin cells. A single treatment in office of microexfoliation in symptomatic contact lens wearers again. When they were checked about a week later, the number of the clinical signs that had been recorded was significantly improved. And you can see them listed on the slide, but we're looking at the level of anterior blepharitis that was recorded, the lid wiper staining level, and the appearance of the meibomian glands themselves and their secretion quality and volume. That also then translated into improvements in the quality of the tear film for these particular wearers as well. And this same set of wearers, again in that week post the single treatment that they had with their cleaning of their eyelid margins, also were found to have a significantly reduced number of bacteria on their lid margins as well. And overall, the level of symptoms that these contact lens wearers were experiencing were significantly reduced just by this one single treatment. And in fact, you can see here that 10 of the symptomatic wearers became asymptomatic 7 to 10 days later when checked, just by having this one procedure done. A little bit more of an in-depth procedure now, but thermal pulsation, you will have heard of this and seen people talk about this, certainly for dry eye disease itself and meibomian gland dysfunction. And there's great evidence there to say that process with heating up the glands, warming up to a therapeutic temperature to soften and reduce the thickness of the meibum, and then massaging to remove meibum from the glands makes a difference in those dry eye wearers or dry eye patients. This particular study took the same equipment and applied it to symptomatic contact lens wearers, again, who also showed early signs of meibomian gland changes. Now, 3 months post-treatment, again, there's a similar set of results coming through all of these studies. For this one, it was 3 months post-treatment, but it significantly improved level of clinical signs around the meibomian gland secretion score, tear breakup time was improved, lid wiper epitheliopathy was improved and looked better. Those patients were using artificial tears less often. But the most striking result from this particular study at that 3-month mark, at the follow-up, was that the wearers on average gained an extra 4 hours of comfortable wearing time. Now, I've worked in a clinical trials unit for 7 years. I can tell you that to get an uplift of even just an hour of comfortable wearing time in a day through one intervention in any study is really difficult to do. So 4 hours is clearly a significant improvement in those patients' level of comfort and their overall contact lens wearing experience. More simply, people have explored the use of a lipid-containing eye drop in symptomatic contact lens wearers to see if that could make a difference. Bear in mind what I said about the tear film right at the beginning. The lipid layer is certainly disrupted and thinner, and in some patients and contact lens wearers might be almost absent completely. So can adding lipid back into the system make a difference? The short answer is yes. These 2 studies listed here explored use of lipid drops both pre and post contact lens wear, and again, improvement in symptoms over a 2-week period. But also they explored use of lipid-containing drops during contact lens wear, which in some markets is off-label use. So you do need to check on what you're allowed to do with the certain drops that are available to you in practice in your own countries. But in this particular clinically controlled study, again, improvement was found, and there was no impact on vision, which is an important point to check when you're adding lipid into these particular patients. But a simple intervention, and to keep it really simple, use it before you put your lenses in and before and after the patient has taken their lenses out. And it does help to improve overall level of comfort while the lenses are being worn during the day. So there's an awful lot of evidence, and as I say, it's growing all the time, where we can help to improve comfort by checking carefully in and around the lid margins, and then taking some of these steps that we might typically only apply to our dry eye patients, and managing our contact lens wearers with symptoms in a very similar way. I think this is really quite new information and really very encouraging, giving us a lot more options in practice. What else can we think about, though? We're thinking about improving comfort, and yet I'm going to talk for a moment about vision. Well, that's because the two are related. We know when you reduce the level of clarity of vision, and so you increase the sensation of blur in front of the eyes of subjects, that the level of ocular comfort scores that they record also drops. So as vision becomes more blurred, ocular comfort perception drops as well. The two are interrelated. And we've seen this recently in contact lens wearers with the output of a couple of studies, where both for wearers of soft toric contact lenses and wearers of multifocal contact lenses, the overall vision scores were correlated with the overall comfort scores. And what that means is someone who was seeing very clearly in their contact lens and satisfied with their vision was also someone who was going to be recording a better overall subjective comfort experience as well. So to help uplift comfort, absolutely, it's really important to always go back and make sure vision is fully corrected and that the contact lens wearer is really satisfied with the level of vision that they are getting. And that's particularly important when we think about our astigmats. Now, astigmats with lower levels of astigmatism, so we're thinking here about 1 diopter, 3/4 of a diopter of astigmatism. We know we can fit them with a spherical lens. We know that they're going to see pretty well. But that really isn't what the evidence is telling us to do, because the evidence says for low levels of astigmatism that soft toric contact lenses are going to give better visual acuity than either fitting in a spheric or a spherical single vision soft contact lens. It's a really important point to make sure that we offer our low astigmats the chance of trying a soft toric contact lens. We wouldn't ever leave a low level of astigmatism correction out of someone's spectacles. The patients wouldn't ever expect us to do that. They're not used to that happening. So why would we do that in contact lenses? And once we do that, those low-level astigmats fit into a soft toric contact lens with their better vision. No surprise, of course. They also then can tell us that they're better, the more overall satisfaction levels are higher for normal day-to-day tasks. So for reading at near, looking at digital devices, things that are really routine and common and important to that wearer become much easier, and their wearer becomes more satisfied when they're fit and looking at those with a soft toric contact lens correction, a full correction, rather than having their astigmatism uncorrected and left in a spherical contact lens. Now, it's important, I think, to note that perhaps one of the concerns we historically have had with recommending soft toric contact lenses routinely is the extra costs associated with them. But we should always remember that the patient themselves, when they are asked, they expect their eye care professional to recommend the best solution for them. And you can see here the final piece of information that's popped up on the slide. So 86% of contact lens wearers are expecting their eye care professional to recommend the lens for them that's going to give them the best vision, regardless of cost. They want to know what their options are, and then they can make an informed choice from there. So we shouldn't hold back at this point because we're worried our particular patient may not wish to invest into a soft toric lens experience. And a few other of the concerns that people may have had with soft toric contact lenses in the past, really, again, there's a huge amount of evidence now that turns some of those thinking around, some of that older thinking around. We may have been concerned in the past that soft toric lenses take an awful lot more chair time to fit and to get right and to get to a final prescription. Well, we know, of course, that that's not the case, and we have great evidence to back that up and to say that that is now very simple to fit. And soft toric contact lenses have been shown to be just as quick to fit in practice as a single vision spherical contact lens. So chair time should not be an issue. And modern soft toric contact lens designs have been shown time and time again to give clear and stable vision. So to give very reliable, very repeatable vision for our astigmats. So again, that was an older and historical concern that a soft toric lens may not sit consistently in the right position in the eye, and patients would have vision that would be very in and out and fluctuating throughout the day. We absolutely don't need to be concerned about that with the wide range of soft toric lenses we have available to us now. But astigmats are often unaware that they can wear this type of lens, either completely unaware, talked about in the past or tried them many, many years ago, and haven't ever been able to come back to them because they didn't think they were suitable. So we have such an opportunity to always be offering these astigmats, and particularly low astigmats, the chance to have their vision fully corrected in contact lenses with a soft toric lens design. Now, one of the final things I wanted to talk about when we come back to thinking about optimizing comfort, and this is for our frequently replaced wearers, those in a 2 or certainly a 4 weekly replacement schedule soft contact lens. They, of course, are using a care solution, a cleaning solution. And we know that comfort can be altered depending on the combination of cleaning solution and contact lens material that they are using. So if someone is feeling a little uncomfortable in their contact lenses, one of the things that we can do, and you want to keep them in that same contact lens, one of the things that we can do, and there's evidence for that, is keep the lens the same and suggest a different multi-purpose solution, and that combination for that patient may feel a little better. If you're going to do that, I would advise, if you want to stick within a multi-purpose solution option for that patient, obviously pick one that has a different level of ingredients, preservative and surfactants in to the one that they're using. Make it different, make the system different for them to give a chance for them to experience whether the comfort changes. You can also recommend that wearer in reusable contact lenses switches from a multi-purpose preserved system to a hydrogen peroxide unpreserved. There's a great review that was published a couple of years ago, again, looks at bringing all the evidence together around hydrogen peroxide systems, showing improved compliance, great efficacy, of course, over time for that particular system, but also improved comfort and ocular surface outcomes for these patients as well. So hydrogen peroxide systems are a great option for many patients. And then the final thing you can do, comes all the way back to the beginning of the talk really, is you can remove the lens care solution completely. And that would mean going from that reusable monthly situation and recommending the daily disposable situation and using that evidence that I talked about right at the beginning as when you're talking to the patients. Okay. So I've been through the slides today talking about improving comfort. We started off with that shoe analogy, changing from the uncomfortable shoe to something that's soft and supple on the foot and it's going to feel better. And when we conclude today about improving comfort in contact lens wear, certainly and absolutely changing a contact lens, changing the contact lens material, design, changing its replacement frequency has good evidence to say that yes, absolutely that can improve comfort for many wearers. So it's a perfectly sensible and valid thing to consider. But hopefully what I've also talked to you today, I give you, and hope and that you can leave with from this talk, are a number of other ideas that are evidence-based that would allow that patient and wearer to stay in the same contact lens, but you can also then help to modulate and modify their comfort. And that might be through a change in recommendation of their contact lens solution. It might be through really careful attention to optimizing their vision and the effect that that can have on comfort as well. And we talked at length about the evidence for soft toric contact lenses in low astigmats and the importance of always recommending those. Or it may be a careful look at their lid margins, their meibomian glands and quality of meibum and their lipid layer on their tears, And the number of pieces of evidence I talk through there that we take from our knowledge in the area of dry eye disease that we can apply to our symptomatic contact lens wearers to also help to improve their comfort. So as I started this talk, I gave the headline that I think it's really good news that we have an increasing amount of evidence and an increasing number of options available to us in practice to help improve the comfort situation for our contact lens wearers. And I think with that, I'm going to finish my slides and say thank you very much. And thank you very much for your time in listening to me today.